In this tutorial, I'm going to show you how to use BU resources to answer some of the questions that were presented in the oral health modules, and also to help you with the searches you do yourself for your thesis on the topic of oral health. As is always the case, I would start right here from the library homepage. As you've seen in class up to this point, that we always like to start our searches here because all of BU's resources are grouped on our library homepage. So the first place I would go for a question dealing with oral health, I would look at our oral health subjects A to Z subject guide pages. So I just click here and go down to D for dental health, or dental medicine I should say. Dental medicine is one of the largest pages that we have. I think only public health is bigger. You can see it also links here to related pages. In this case, it would be evidence-based dentistry, which is also a great resource to use if you're writing an oral health thesis. So you can see here, like all of our subject guide pages, these first two links here link out to our catalog and all the print books we have on dentistry. If you scroll through, you'll see a list of all of our ebooks, databases you recommend, e-journals, recommended websites, professional organizations, pretty much like every other web page that we have, subject guide we have, but this is a much larger one, like I said, on dental medicine. So the first place I would start if I needed some sort of background information, and we'll talk more about background and foreground information in the fourth week when we talk about evidence-based practice. The place I would start would be probably an ebook. Excuse me. So you can see we have quite a few ebooks here. If I click here on this link, you'll see a list of all of the ebooks. There's again quite a few, probably about 100 or so. That searching here just by title is probably not the most effective way to do this. I would like to search all of our ebooks at once on a certain topic to make my life a little bit easier. The best way to do that, if I go up here to the e-resources link and click on ebooks, the most popular ebooks that we have are in this little box up here. It says quick links. And not only individual books, so Harrison's is a bunch of books from one publisher, ACP-Pierre is a single book, BMJ Clinical Evidence is a single evidence-based medicine book. We also have a couple of what we call ebook suites. So Access Medicine and StatRef are a group of titles from the same publisher that you can search all at once. So I think the most useful one for any kind of dental question is this one here, StatRef. I'm just going to click on that. So it's going to ask me to log in here. The first time you use any of our resources, you have to log in. And I'm probably going to have a typo, so just bear with me here for a second. I usually do. I'm not a very good typist under pressure. So again, as predicted, I actually did get this wrong. A little embarrassing, but I'm just going to go with it. So I managed to get it right the second time here. So every time you log in on your browser session, you're going to have to do this once. After you do it once successfully, you're all set. You don't have to do it again. So StatRef, like I said, is a collection of about 30 different books, most of which are on dental medicine or oral health. So I wanted to, if I just click on any one book here, I mouse over, it'll show me what that book is. But if I want to, I can search all the books at once. That's what it's like here by default, but I could also click here and say select all. If I wanted just a specific book, say I wanted this, say, oral pathology here, I could just click on that one book to get that one book. But again, I'm going to search them all at once. So thinking about an example we had from the modules that before this particular tutorial, one of the modules had to do with adult health, and it said that one of the largest problems adults face when it comes to their oral health is the erosion of their teeth, dental erosion. So say I wanted to search StatRef for information on dental erosion. I'm just going to type dental erosion in here. So you can see that StatRef does a pretty good job of trying to map back to the terms that you typed in, so it does fill in dental erosion for me, so I'm just going to click on that and say go. StatRef now runs a search of all the books in its holdings to try to find me results that are relevant to that search. Excuse me. So StatRef does a pretty good job here on the left-hand side that this is something that database theory calls clustering. So it goes through those results that it found and it tries to pull out relevant information about the resources that it found. So it tells me that of these 192 hits, 10 of these come from a point of care title. So point of care title, again, we're going to talk more about that in week 4. But that's something that you would use, say, if you were dealing with a patient in front of you right now, or kind of you're at the bedside of a patient, that it gets you immediate results you can use right away for treatment. If I click on this little triangle here, it's going to show me, so all 10 of those hits came from the same book, ACP Peer. And I could click on any of these chapters here to go into that specific chapter. I can also go here, titles by disciplines. This is broken down by sort of the category. So of these 192 results, 171 come from dental resources, 8 come from family medicine, 1 comes from a nursing textbook. So again, if I just wanted, say, surgical interventions for dental erosion, I could click on this heading here, and it would just show me those books from, the perspective of surgery as an intervention. But in this case, I'm kind of interested in this book here, number 3, this book on aesthetics of dentistry. So if I just click here, it says View in New Window. It's going to jump just to that chapter of that particular book where this was actually mentioned, which is nice. I'm just going to blow this up so I can see this chapter a little bit better. Excuse me. So you can see that it actually jumped down to the case studies in this chapter. I'm just going to jump back up to the heading here for erosion. So you can see it gives a nice kind of succinct definition here exactly what dental erosion is. It talks about some of the things here like bulimia that can cause it. It talks about some other sort of factors, etiologies here for how this can happen, lifestyle factors, things like that. So it does a pretty good job of actually explaining that topic. Most of these books do a very good job of getting you the answer as quickly as possible. You can see that the term I typed in, dental erosion, is highlighted here in yellow, so it shows you exactly where it shows up in the text. And every time dental or erosion shows up here in the text, it gets this kind of green highlight, which is nice too. Something else that I think StatRef does really well, if I scroll down here a bit, that you can see that say there might be sometimes terms in a definition or a caption you don't necessarily understand. So say I didn't know what labial, which of course means pertaining to the lips, if I didn't know what that meant, I can just highlight that word, and then StatRef goes out and tries to find me a definition of that word in the dictionary, which is nice. So say I'm wondering what the labial gingiva is, I can click on this, and it's going to bring back a definition for me, which is nice. So it's really good. You don't have to go out, say, to Wikipedia or some source like that, which I wouldn't trust anyway, but that's beside the point in this tutorial. You can just actually click on it here to get a view of the dictionary definition of something. You can also, while you're here in StatRef, I'm just going to go back up to the top, that say you would just wanted to use that dictionary in general, so I'm just going to close this out, this page here. You can see if I click on bookshelf, it's going to show me all of the books actually included in StatRef, which was nice. And one of those books is actually Stedman's Medical Dictionary. So I could scroll down here a bit, and I can see Stedman show up as a title right here. So I could just click on that to go into the title. Or I can also just do it from home. And while I'm here in the home page, I could also get to Stedman's from here. So they give you a couple of different ways, excuse me again, to get to the resources you want. So I can get to Stedman's right here as well. And it's just nice, you can also do it while you're actually inside of that particular chapter that you're reading to get some information. So we do have, like I said, quite a few. I think we have 7,000 textbooks total, and you can easily search them through these ebook suites. And you probably will be using some textbooks in your thesis in the lit review. But I know that Dr. Davies always says that about 75% of the resources you're going to use in your thesis are going to be peer-reviewed journal articles. And the best way to search for peer-reviewed journal articles, of course, is going to be PubMed. So I'm just going to go back here to the library homepage for a second. And again, if you look at any of these subject guide pages, if we went back to the dental health one, there's going to be a link to PubMed from that subject guide. We link to PubMed from every one of our individual subject guides. But you can also get to PubMed right from here where it says Find Articles, or here from this Medline link. Either way, they're all going to PubMed. So I'm just going to click on PubMed here just to show you this link works the same way. So we do recommend you go to PubMed from the links from the library homepage, only because if you go to PubMed from our special BU link, and you see it says here this bu.edu, any journal that we actually own, we can link to PubMed this way just to save you a few clicks for getting your hands on the full text. Okay, so I just talked a second ago about dental erosion as a problem we saw from the tutorial that affects adults. I also saw something in that earlier tutorial about children that early childhood caries, or ECC, is a big problem with kids. That I think it was 40 or 50% of all children at some point experience some kind of a problem with dental caries. So say I wanted to search for articles in PubMed about that topic. So I'm sure you've used PubMed before, and you may have already seen this in class depending on when you actually watch this tutorial. But most people search PubMed the same way they would search Google. They just type in a couple of words and start a search that way. So I'm just going to type in, say, dental caries in children. So you can see if I start to type this in, PubMed tries to help me complete my search, just like StatRef did. So I can see here is, say, dental caries children. I'm just going to click on that and do a search. So PubMed by default tries to make your search as useful as possible, and by useful, PubMed means big. So 16,000 results came back from the search that PubMed sort of suggested for me. We librarians know, they teach us in library school, that the average person at this point when they're using any kind of a citation database like PubMed, when they do a search, when they get more than 100 results, they start to panic. So 16,000 results is obviously way too big. And as I said, PubMed tries to make your search as useful as possible, and by useful, PubMed means big. So what PubMed actually did, if I scroll down here a bit on the right-hand side, you'll see where it says here search details. So PubMed did this search for me here. It actually adds all these terms automatically to the search that I've done. So we're going to talk about this again in week 4 about mesh terms. So this is actually what PubMed really is searching for, dental caries as a mesh term, or I should say that's really what you want to search, where it's going to get you the most targeted search possible. So some of these other terms here are kind of extraneous, which is why we get so many results. So I just want to search PubMed directly from the mesh database to sort of get after what I want for the actual results. So there are a couple of different ways you can get to the mesh database from PubMed. I'm just going to click here to get back to the PubMed front page where we started. So there's a link to the mesh database from here, but at some point all of these links are going to go away. The PubMed designers think this looks too cluttered, they don't really like it. So at some point all of these ones here are using PubMed tools, and more resources are going to be gone. But they did tell us that they're always going to leave a link to the mesh database from here, from this dropdown. You can actually get to all of the different NCBI databases from here, but the one we're interested in right now is actually the mesh database. So let's go scroll down here, click on mesh, and then say search. So I know that the term I'm really after is dental caries, so I'm just going to type in dental caries here into the mesh browser, and do a search. So this shows me that these are the valid mesh terms that have dental caries in them, and the top one here is really the one that I'm after. So I'm just going to click here where it says dental caries. When you get to a valid mesh term, it's going to show you right here. The first thing you see is what this definition here is called the scope note. This is exactly how PubMed defines this term. If I scroll down a bit, these are the entry terms. So say I typed in dental decay, or if I typed in white spots instead of dental caries, this is just PubMed telling me that these are just synonyms. So if I typed in one of those terms, I would say that dental caries is definitely the right term for me to use, which is great. If I scroll down a bit too, the last thing you see is the way that PubMed actually organizes these topics. All the mesh terms in PubMed are in a hierarchy. It's just called the mesh tree. So I can see that dental caries, the term that I'm after, is a more specific type of tooth demineralization. It's a more specific type of tooth disease. So if you do a search in PubMed and don't get enough results back, if you choose a term that's too narrow, you can always step back up to the parent term. Similarly, if you only cared about root caries, you don't have to search for all caries in general. You can always step down here to root caries and just search for root caries instead. So it's nice if you look at the mesh tree here to see where your term falls. You can always make your term broader or narrower by stepping up or down to the more relevant term. But I think in this case, I definitely want to use this dental caries as a term. Now I know that in my case, say I was thinking about dental caries in children, and I really want to figure out the best sort of interventions from keeping kids from getting cavities in the first place. So a really good subheading to use in a case like that is this one here, prevention and control. So I'm just going to check that off. So what I have to do now, there are no articles here in the mesh database, only the articles are in PubMed. So I have to figure out a way to get this search term that I want to use from here back into PubMed. So the way I do that, if I click here where it says to add to search builder, I can build my search here in this box and then send my search when it's done back over to PubMed. So I want to start just with this term here, this dental caries, / just means subheading, prevention and control, and say search PubMed. So it sends my search back to PubMed. So now I've got 11,000 results. So I had 16,000 before, so I really didn't save myself that much trouble. But there's nothing here about children yet, just dental caries as a topic. So I can certainly add children as sort of the population that I'm after. The way I can do that, you can see here off to the left-hand side where it says show filters. I can now put filters onto my search to make it even more specific to what I'm after. Now unfortunately right now I don't see anything here for age, but age is a filter. PubMed, for whatever reason, I honestly don't know why, they don't show you all the filters you have available by default. If I click here on Show Additional Filters, I also have all these options here as well. So I'm just going to check all of these off here, just to make my life a little bit easier, and say Show. Now it's not actually turning these on yet. It's just giving me the option to add these if I want to. It's just showing me now all the ones that I have an option to use. So I'm actually, with these early childhood caries, I'm looking for really sort of young children. So I can click here for ages and see all my age options, but I think really this one, infant to 23 months, and then probably preschool child 2 to 5 are the ranges that I'd be after. So it's going to say Show. Again, it doesn't actually turn these on, it just displays them as options I can use. So I'm going to click here where it says birth to 23 months. That limits it down just to 924. And I'm also going to say that preschool child 2 to 5. So that brings back now, say, 2,300 articles. So something else that's very useful if I scroll through here, that sometimes you'll see that not all these articles are in English. So for example, this article 19 is in French. Anytime you see the title in square brackets, that means that particular article is not in English. Now I know many students are fluent in languages other than English. The thing is, we tend to only collect things at BU in English. So it might be really hard for us to find this article for you in French. It might take us months to get it in after this, certainly after this assignment is due, maybe even after your thesis is due. So sometimes it's easier just to limit to articles written in English. So you always have that option here from language. So I'm going to say here just English. So that gets me down now just to 1,600 articles, so dropped a few hundred articles out right away. So 1,600 is still somewhat large, but it's much better than the 16,000 I had a minute ago when I just did dental caries in children in PubMed using the broadest search possible. And what you can start to do now too that's useful, so something you have to do for your thesis or for anything you're going to be writing for the rest of your career, a grant proposal, a journal article, when you do a lit review, sometimes, and this makes sense, that you want to start with articles that also are reviews themselves. Let's kind of get an overview of what's going on in the literature. So you can see here from article types, I have the option that I can say, I can look at just review articles. So if I click on just review articles here, so these are papers that go out and they look at sort of all the state of the literature today, and they limit this just down to, they write a paper about looking at all those papers out there right now, kind of a synopsis of the state of the literature today. So review articles are really a good place to start for you to sort of get an overview of the topic in general. More specifically, a type of review article, the best type of review articles is one underneath here, systematic review. So I'm just going to check off review and go to systematic review. A systematic review is a much more methodical, thought-out sort of review article that they just don't look at all the state of the literature today. They evaluate all of the papers that they find, and they only include the ones they determine to be the best. And once they include all the papers they determine to be the best, they usually run sort of a statistical program in the background called a meta-analysis, where they weigh all of the evidence that they find, they standardize and normalize all the evidence, so they can actually compare the results from different papers and draw a really good conclusion. So there's only 64 of these systematic reviews on our topic, which is great. But I can also narrow that down even more to make it more relevant that, for example, this first journal here is a pediatrics journal, and there is actually quite a few results that come back in medical journals in general, but maybe if I'm thinking about dental caries prevention and control from the perspective of a dentist, I can actually scroll down here a bit where it says journal categories. I can limit just to articles from dental journals, so I can click here on dental journals. And now there's only going to be 49 of these systematic reviews from dental journals. So it's a really nice way to kind of limit down to, if I'm writing this from the perspective of a dentist, or if you're an oral health concentration student, you're in dental school a couple of years from now, it might just be nice to look at the journals that pertain to your particular profession, dentistry, and see what results are out there for you as a dentist. So there are 49 of these articles here. So say if I start to look at these articles, say in general, this very first one here, this Cochrane review on the benefits, risks of fluoride toothpaste. Cochrane, and I'm sure you'll hear this over and over again in your classes, Cochrane is the gold standard for evidence-based practice, either dentistry or medicine. So anything with Cochrane in the title, I'm just interested in right off the bat because Cochrane is the best resource. So I'm just going to click here on that article in Cochrane. Or I should say that refers to Cochrane. So now I can look at this abstract. So maybe if I look at this abstract and I start to think that this is a really interesting article. So it's, has this thing about sort of fluoride as that particular intervention for controlling cavities. So maybe this article isn't perfect, but I sort of like the direction this article is going to. So there are a couple of things I can do to find other articles like this article in PubMed. If I click here where it says publication types, mesh term substances, I can see all of the mesh terms they use to index this article here in PubMed. So I can see that karyostatic agents, that's obviously things that fight cavities. That's an interesting mesh term. Maybe that's a better term than just dental caries prevention and control, which is actually right here too, because that's how I got to this article in the first place. I could also use, say, fluoride as that specific karyostatic agent, or even toothpaste as that specific sort of delivery mechanism for fluoride or karyostatic agents. So when you look at the mesh terms for an article that you like, it gives you ideas that other mesh terms you could use to do another search. I always say that no one gets a search right the first time, but you should learn something from every search that you do that makes every subsequent search better. So I kind of like some of these ideas, so maybe I wanted to use karyostatic agent as a mesh term for my next search. If I want to from here, if I left click on any of these terms, I have three options. So I could click here to search PubMed for any article with this karyostatic agents, administration, and dosage as a subheading. I could also add this back to the search I've already run, so those 49 systematic reviews I have from dental journals. It would also add this term, so it would just look for, of those 49 articles that also had karyostatic agents as a mesh term. Or I could click here and go back to the mesh database just for this term karyostatic agent, start my search again from scratch and do this all over again. That can take time though, so a few years ago, PubMed also added an option here on the right hand side. You'll see this related citations in PubMed. What they do, they run an algorithm in the background that looks for all these mesh terms here that index this particular article, and they look for other articles like this article. It's kind of like a relevant search in Google. So if I click here on See All, usually brings back about 100 articles. In this case, it brings back 171. And you can see that these articles are all very similar to the article I started with. So here again is fluoride toothpaste in children, topical fluoride, so this is just fluoride, not so much toothpaste by itself. Again, something that mentions Cochrane, toothpaste. So toothpaste, fluoride, children are all these same articles that are coming back, which is nice. So if you can find even one article in PubMed that you like, you can have PubMed find you other articles like the article you started with. Something else you can do which is really useful, and when you start to do your lit review, you're going to come across the top authors in your field, or maybe your advisor or your readers can tell you, definitely check out this person. This particular author is someone really worth watching on this topic. So you can see it's a very kind of casual analysis. These top, say, 4 or 5 articles, we see the same names over and over again. So here's MC Wong here. Here's MC Wong here. We see this VC Marino here. We see the author here again. We see the author here again, the author here again. So these same 4 or 5 people seem to be writing about really concentrating on using fluoride toothpaste to prevent cavities in children. So anytime you see an author name like that, or if somebody told you, VH Marino is a really good author, somebody you should check out on this topic, you can always have PubMed help you find articles by a specific author. So say I want to use this MC Wong from the first paper here. When you look at any author name in an abstract in PubMed, you can see every particular name is hyperlinked. So if I click here on MC Wong, it's going to pull back all of the papers in PubMed by somebody named MC Wong. Now the reason why only this one paper came back, all of my original filters are still on. So this is really any article about our dental caries prevention and control in English, about children, from dental journals and systematic reviews. So it's really kind of limiting. If I turn that off, you can see there's actually 345 articles by anybody named MC Wong. So PubMed only looks at the first letter of the first name. In some cases, it looks at the first letter of the middle name, but not always. He's like this M Ong, there's no middle initial there. There's no middle initial here for N Matthews. It's just the N, no middle initial. So sometimes, even if you know the author's name, you still get a lot of results back. So there's 345 MC Wongs out there. So what you can do, though, to make your life easier, and this works for other sorts of searches too, is that PubMed keeps track of every search you've run for the last 8 hours. So you can now go back and combine elements from different searches to build a new search. The way you do that, if I click here on Advanced, you can see that PubMed keeps track of every search I've run over the last 8 hours. So here's that search just for MC Wong as an author in general. Here's that bigger search I had for dental caries prevention and control with all my filters, the English, infant, all that stuff. So if I want to put those two searches together, all I have to do, where it says add here next to the search, if I click on add next to that set with the 1605 results, I'm just going to click here next to number 7. And if I click here on add for the author name, MC Wong, you see it adds both of these searches together in this box. Excuse me, if I just click on search, it's going to run a search just for those two results together. So now this is every article in PubMed by somebody named MC Wong about dental caries prevention in children from 1 to 5, or 1 month to 5 years. So it's really a nice thing if you know a certain author name and a certain topic, you can have these searches together. So it's just another option you can use to help you get your hands on the articles you need kind of as quickly and efficiently as possible.